Let's talk about diabetes and infertility. Diabetes is on the rise. As an Asian, especially Bengali population, we suffer from diabetes. It's I think it is very, very high. The incidence of diabetes is increasing day by day, and our family history, if you ask somebody, family history is obviously positive. So uh, we almost all of us have diabetes in our family. But diabetes at which age it is presenting, that is very important, and it is a lifestyle disorder as well. So that's why we say diabetes is not only genetic, it is polygenic. So genetic plus your habit of eating, your lifestyle, your addiction, everything affects. And that's how only family history. You cannot blame only for the family history. I have got family history, that's why I'm diabetic. It's not like that. It's not like 1 plus 1 2. So diabetes, how can you prevent diabetes? One is your regular exercise to burn calorie, and because it is, after all, the disease of insulin hormone. So carbohydrate metabolism, how can you improve your metabolism? That is low carbohydrate diet with exercise to burn this carbohydrate that gives us an immediate energy. It is the key thing or mantra of preventing diabetes. So regular brisk walk or exercise, sweat producing exercise is very important at any age. You name it, at any age it is very important to prevent diabetes. But carbohydrate, you cannot avoid carbohydrate. You cannot eat only protein. So protein, fat is important, but carbohydrate little bit is important, fiber is important. So complex carbohydrate which containing high fiber, that is good for diabetes. So if you are taking rice, because we Bengalis are tremendously, we love our rice. So amount of rice, you restrict the amount, and you can swap sometimes with this rice. You take 2-3 times a week, and you can swap with something, other complex carbohydrate like barley, or some buckwheat, or some millets like ragi, bajra. So these are better carbohydrate, and some of the seeds and nuts and fruits that gives you energy, fat, mineral. Consider that. And protein diet, if you are non-vegetarian, then anything other than red meat like fish, chicken and egg is very good. You can take it in a balanced diet. You can take every day little bit of this and that, and mix and match, and your diet is a full of protein and fiber rich diet is very good for diabetes, very good for controlling diabetes, controlling weight. If a diabetic patient is obese, that means you are not controlling your carbohydrate. That's why your diabetic control is poor. So diabetic, when the diabetes is very good control, that means you are lean and thin. So, and that gives a boost to your body, and your genetic material improves. That means your egg and sperm, here we are talking about the quality. When your diet is good, rich in fruit, nut, oil, vegetables, then your egg quality, your sperm quality is good, chance of fertility improves. But if you are poorly controlled diabetic, all the organ suffers, all the cell suffers from this extra glucose level, and that's why your egg quality poor, your chance of conception will be poor, no matter you are doing IUI, IVF, whatever treatment. But nothing can cause magic. We see if the male is poorly diabetic, their sperm quality is bad. Sometimes we make pregnancy out of it by IVF, but still your wife might miscarry from that pregnancy. So try to improve your diabetes, strict diabetic control before you fell pregnant, or when you are planning pregnancy. Please try to control your sugar. Otherwise, sugar can damage your egg and sperm. As a result, poor quality pregnancy, chance of miscarriage is very high. And abnormality for a pregnant woman, if the diabetes is not controlled, structural abnormality of baby increases, So it is always advisable before pregnancy or when you are planning pregnancy, please check if you never have checked that you are already diabetic or not, because sometimes there is no symptom, you can be diabetic. Or if you if you know you are diabetic, please control your diabetes before you fell pregnant.